Rory, speaking about Dunning-Kruger effect in trauma-informed therapy.
Yes, I came across this interesting psychological phenomenon when I was actually building a trauma-informed practice course. And it's a theory that was published in 1999 by Justin Kruger and David Dunning. They were social psychologists based in America. Dunning-Kruger effect states that people routinely overestimate their own performance in areas they lack competence, and they dismiss evidence that would prove them wrong. And the bizarre thing is that I may have been affected by Dunning-Kruger effect. And let me tell you why. I graduated in 2004, and I was taught by 20th century therapists or tutors who taught 20th century therapeutic ideas. And as I moved along my journey as a therapist, I began to realize there was holes in my knowledge, and that the story I had been told that my therapeutic modality was the necessary and sufficient conditions for therapeutic change, quite frankly, wasn't correct. And that was quite hard to take on board, to be honest, because you know how much stock I put in the world of Carl Rogers. And the reason for that was Rogers died in 1987, and trauma was only just beginning to be understood about 4 or 5 years before he died. And as we moved into the 21st century, new theories came along and taught us about trauma and trauma responses. And not long after I qualified, I did a trauma-informed practice course, and I realized just how much holes there were in my knowledge. And I'm not ashamed to admit this, when I went to this course, I thought to myself, oh gosh, I wonder how much I'll learn, because quite clearly I've got enough information. And it became very clear very quickly that I didn't. I was very grateful for the course that I took and the ability to ingrain or embed trauma-informed practice within my modality. And here's the thing that surprised me the most. I didn't need to change my modality. Being trauma-informed doesn't mean I have to practice a whole new load of interventions or practice in a different modality. It means that I'm informed. I'll give you a little example from my practice life. Many years ago, after doing this course, I had a client who became disassociated quite badly in the therapy room. And I was able to use some of the information and the techniques I'd learned to be able to bring them back into the here and now. And I was ever so grateful of knowing that knowledge. And so was the client, because if I hadn't have been able to do that, the client may well have become quite unwell. So Dunning-Kruger is where we believe that we're experts in things, that what we know is necessary and sufficient, and we find out that it's not. And I think it's something that every therapist should take on board in their journey from graduating through the arc of their practice, not to be too wedded to theories, Ken.
Yeah. It's interesting because it's a cognitive bias, the Dunning-Kruger effect. I was surprised when I did the research on this that it was only published in 1999. It's obviously been plaguing humanity since the dawn of time. And it's an interesting cognitive bias that we all hold. And the thing about a cognitive bias is you can't see it. It doesn't show itself. It's hidden to self unless you read about it and learn about it, and then we can look for our own cognitive biases. I want to share a little bit of the study overview because I think it really paints what the Dunning-Kruger effect is and how there are two sides to the coin in the Dunning-Kruger effect. So what they did was they tested the participants on different learning skills, and they were logical reasoning, grammar, and humor. The key findings were that the least competent participants significantly overestimated their performance or what they thought they would get. So you're talking about those that fell within the bottom 25% of scores in this test were putting themselves at 60 to 80% when they were rating how they felt that they did this. Now, the interesting thing is those that scored highly and did really well on the test, they underestimated how they had done on it. So there's the double side of it. I know, Rory, you are a trauma-informed therapist. You've done training in trauma. You've taught trauma at practice level. But I'm sure you would not say, I am now an expert. And that's because you know so much more. And the more we know we don't know. I'm sure you don't go, I'm not buying any more trauma books now because I know everything there is to know about trauma. And I think that's the other side of the Dunning-Kruger effect, is that when we do know something about it, we know what we don't know, and that's when we dig a little bit deeper.
Yeah, absolutely, Ken. Since doing that course, I spent a lot of time with new ideas in treating trauma, how trauma manifests itself, what causes trauma. It was quite interesting when I did my presentation at college all those years ago. It was on trauma, and at the time, the thought was that it was only huge events like wars. The thinking at the time was that it was massive traumatic events, air crashes, wars, that type of thing. And now we know so much more, and we're seeing that trauma appears in our lives quite regularly, and it can affect us. It can affect our thinking. So you're absolutely right, Ken. When I did my trauma course, I thought, I'm going to know about trauma now. It taught me that the learning never stops. And it seems to me that every few months there's some new information that comes out about trauma. And interestingly enough, I did a Facebook poll, asked 100 people how much information they were taught about trauma on their courses. Or was it enough to be able to work in a trauma-informed way? 100 people responded, and only 7 of those people said they got enough information. I don't think it's being taught. I think we're still teaching 20th century ideas.
Yeah, I agree. We're learning the theories and we're learning the basic skills to become a counsellor. But makes sense then that we're ethically called upon to do continuing professional development. It's going to be in your ethical framework. We're speaking now Dunning-Kruger, and we're linking it to trauma-informed practice, but it applies to all elements of practice. It really does. And as we go through the arc of our practice, we're always learning. We're always adding more knowledge. I think back to when I first went out into placement, and I giggle. I wonder how I actually managed, to be honest. But we do the best we can, and we're there in service. You bring your heart in, and you're wanting to heal. You're wanting to be there with people that are struggling. But adding in the knowledge, learning the theory and the mechanisms beyond the core training are so important. You don't know what you don't know. We have a tendency to maybe overestimate that we may know what we don't know. And when we really know something really well, we may underestimate our knowledge of that, also known as imposter syndrome. That comes when you know something really well. It's almost like we can't win as humans. We're always on the end of some cognitive bias. But why we're linking it to this is because with trauma, it can be damaging. So misinterpreting trauma responses through assuming can be not just not serving to the client, it can actually do damage. Overestimating our own ability to handle a complex trauma situation, and the client going there because we're leading that way, and then finding themselves in difficulty and us not knowing why that happened or how that happened or what to do within that situation, and causing harm, really, which is the opposite to what all of us go into this for. So it can be a tricky area.
Absolutely. I think it might be worth considering, if you need additional training, maybe you feel a bit unsure about how to respond to trauma disclosures, how to work with that. You might notice that clients become dysregulated in sessions. You might find them staring into the middle distance, or it's not unusual for adult clients to start talking like children as they are catapulted back in time to where the trauma was. Struggle to differentiate between trauma responses and personality traits. Is this a trauma response, or is this just how the person is? And crucially, absolutely crucially, feel emotionally drained or triggered by trauma narratives. Our work is good work. We do good work. We do it for the right reasons. But I think occasionally we might just deny the impact on self. As a consequence of that, it can limit our working lives or just damage us emotionally. And I think that thinking about trauma-informed training can be a great service to yourself as much as it can be to other people.
Yeah, Very much, Rory. When I look back to my understanding of trauma before looking deeper into the topic, my understanding of trauma was misconceived. I thought trauma was the event the person went through. I'm just going to use an example here. The person had a car accident. That was the trauma. And of course, that's not the trauma. That is the event that happened. The trauma is what is carried in the body and how that shows itself and manifests outside of that event. And that can not be seen and sometimes not even linked back to I had a car accident. It may just be I get so emotionally charged and anxious when I drive, and I don't really know why that is. The actual event can be so separate to the presentation. And we're dealing with trauma all the time. We've said this so many times. When a client comes into the therapy room, one thing we know we're going to see is trauma. And not being able to recognize that, see it, and work with that within the room is, I guess we're only going halfway there.